Hi, I'm Kelly Vaughn, and welcome to Inside Indy. And man, it's been a rough, 5 or 6 months since the COVID-19 pandemic hit our country and the world. And of course, that has affected the job market and the economy in ways that we could never even imagine. And but there is hope because there are other opportunities always emerging on the horizon. And here to talk about those opportunities, specifically in the insurance industry, are Chris Lowery, and you are Senior Vice President for Workforce and Careers at Ivy Tech Community College. Welcome, Chris.
Thank you.
And then we also have Emil Ekiyor, who is founder and CEO of Innopower Indy. Welcome back, Emil.
Thank you, Kelly. Thank you for having me.
He's becoming a regular on this show, by the way. And then we have Anne Duncan. She's marketing representative for Arlington-Roe, and she'll be here to talk about the insurance industry as well. Welcome to you all to Inside Indy. Man, as I mentioned at the opening, it's kind of rough out there right now, and there are people, especially our young people, but beyond that, looking for new opportunities. And you're saying then that there is hope in the insurance industry? Who'd like to go first to respond to that?
I can take that, Kelly. The industry, there's a grain of the industry, and I'm a great representative of that. See, there's a lot of baby boomers, and over 70% of the industry is over the age of 55. So we project that 50% turnover probably in the next 10 years. So there's lots of opportunities, but we don't have as many young people coming into the industry as what we need to fill these jobs. And the insurance industry is a big industry in the state of Indiana as well as nationwide. And there are lots of opportunities, and it touches all industries. We're oftentimes the second call after there's any kind of emergency situation. So there's certainly some opportunities in insurance in the state.
Okay. And so in order to be able to work in the industry, obviously we need to be educated. And so I understand that Ivy Tech Community College, Chris, has an opportunity to earn a certificate?
Yes, Kelly, that's correct. We have been working with Anne and her colleagues from the insurance industry for quite a while to really frame that up. And our approach at the college, especially in the past few years, has been to talk with people who are in, various business sectors and to say, so what are your needs? Rather than us just guessing, I wouldn't be the person you would want to guess about what the insurance industry needs. Anne is, because of her expertise and her tenure there. So what we've done is collaborate with, as I said, Anne and her colleagues from the insurance industry to say, so what exactly are the specific skills that you're seeking, to fill these really good positions, and they've helped us outline those. And that has resulted in a 9-hour certificate. And certainly we can talk more about that because the certificate allows an individual to enter the insurance industry, again, a great industry, but also with potential for growth. While in a position or with one of those employers, but also in their own academic career. So if you think about paralleling that growth in career along with growth from the academic standpoint and continuing to, I guess the way I think of it is move from sort of that ladder of a job to a better job to a career. I think this is a perfect example of that.
Okay. So in that, you said it's 9 months, right?
9 credit hours.
9 credit hours. So how long does it take to complete that particular course?
Someone could easily do that in a 1-semester period. And honestly, even with our new 8-week terms, someone could, and you jump in here and tell me if I'm wrong on this, complete that within an 8-week period. Now that's probably a lot, and for some individuals in just that short time frame, but certainly within a traditional 16-week semester.
Okay. And did you want to add to that?
Yeah, the original certificate that we kicked off in 2017 was 21 credit hours, Kelly. And over the summer, we collaborated with Ball State University, Indiana State University, and Butler University, who all have 4-year degree programs, to help rewrite that curriculum. And it's now reduced down to 9 hours. So it's something that can be finished within a semester. And then the individual would probably be able to go out to an entry-level position. They could continue their education at Ivy Tech to get a 2-year degree. And then if they choose, they could go on to one of our 3 other insurance schools in Indiana and get a 4-year degree.
Okay. Now, I know about insurance in terms of buying life insurance or something for my car, but for a person who's interested in that career, what are the opportunities? Is it about being an agent, or are there various opportunities within the industry?
There are a lot of opportunities, Kelly, and I think there's a misconception about the industry that it's all about sales. A lot of people think you got to knock on doors or be a salesperson, but there are job opportunities at insurance agencies, at carriers, so a customer service representative. Then, of course, we've talked about insurance sales. There are claims opportunity. There are actuarials. We need IT folks. We need folks with accounting. It touches all industries. When you think about even at Ivy Tech, I think there's an automotive certificate. That person, if they also got the insurance certificate, could go on into becoming a claims person, adjusting auto claims. There's a lot of talk about coding. There's a lot of talk about cyber liability. We sell data breach policies. So it touches lots of industries.
Okay. This is for Emil. Why is it important for students to engage in the industry, to develop those credentials and partnership with the industry members, and how does it help the state economy?
Thank you, Kelly. As you know, for decades, the traditional way was industry waited for the talent to graduate from college, and then you get to pick the best of the best to come into your industry. Well, today we know that model doesn't really work efficiently anymore. Industry has to have skin in the game in the development process, and that starts in high school, and in some cases even before high school. Today, what we've witnessed with COVID and what we know is the number one word used in minority communities especially is access. Sometimes people are not aware of the opportunities that are available for them out there. As you hear, the key word that's been used with Anne and Chris has been opportunity, opportunity, opportunity. The program gets designed, the insurance industry and Ivy Tech, and they've designed a magnificent program. But now, how do we articulate that program to the community so people see this as a pathway to upper mobility? And so what we do is say to young people is there's opportunity available for you, and here's a pathway to get that opportunity, and here are your options. Your options are you can take this course at Ivy Tech, get exposed to the industry with job shadows, speaker series where professionals from the industry are coming in to engage these young people, to make them familiar about the industry. Then if you graduate with this certificate, 9 hours sounds simple to a young 17-year-old. It's doable. I can take this 9 hours and I could actually get a certificate and make $17 an hour when I graduate from high school. That gives them a vision for what's next. What we miss a lot of times with young people is not understanding what comes next. If I don't go to college, have I failed? What the insurance industry is saying, what Ivy Tech is saying is, no, you haven't. Ivy Tech has a pathway for you that you could begin in high school. So what we do is come along with Ivy Tech and the insurance industry and say, how do we eliminate the barriers for these young people if they have to pay for this course at Ivy Tech? How do we work with the schools to make sure they have access and can take these courses? So together, we work to design this program to say, how do we reach the customer and make sure the customer can maximize this program? So we're excited about the opportunity and the trilateral partnership here to do this. But we also feel like this is such a model for other industries to follow, that we can codify this and take this to other industries to say, when we talk about equity, when we talk about creating opportunities for young people, when we talk about staying in a city that we say ranks in the bottom fifth for upward mobility, but yet we have all of these opportunities available, something is missing. There's a gap somewhere. So, just excited to be working with the insurance industry and Chris to just connect the dots and eliminate those gaps. And this is such a powerful model for us to codify and share with others on how industry can have skin in the game in the development process and then how we can maximize programs like this and share these outcomes as we go.
Okay, wow. And you're right about kids. If you just kind of leave them hanging there, they don't know what to do. Get them started in something, get them engaged, and that gets the wheels turning. And then you don't know what's next. That develops into owning your own business one day. I mean, but they have to be involved, engaged. And again, if the goal is too far out there, like how do you even get started? So I think you're right on point in that. So we talked about young people, but what about adults for this certificate and getting involved in this way? Is it for anybody?
So there's a lot of programs now for the adult learners at Ivy Tech, and there are people out there looking for a career change that have been displaced from their existing jobs. So this is a great time for the adult learners as well, Kelly.
Okay,
Yeah.
so how people, oh, go ahead. Was somebody going to add to that?
Oh, I'm sorry, Kelly. Yeah, I was just going to add on to that really quickly. And Anne, thank you so much. So whether it's this certificate in insurance, or whether it's something in advanced manufacturing or logistics, or more broadly in business, healthcare, IT, there are a number of programs, including shorter term, such as these, that can be completed pretty quickly, that are available. And we're seeing a tremendous response in our partnership with business and industry, as represented by Anne, with individuals reaching younger students, adult students, like in the instance of our partnership with Emil, but then also in our partnership with state government. We're literally right now reaching out to individuals in Indiana who are unemployed and underemployed, with partnership with the state, to make these programs more readily aware, to make sure folks are more readily aware of them, and helping point people in the direction of good and promising jobs that can result from these types of credentials.
Okay, sounds good to me. So if people want to take advantage of this, to sign up or to learn more about the insurance industry certificate, how do they sign up?
Well, Ivy Tech has all the resources on their platforms, and has all the capacity to engage people, to walk them through the process of signing up and all the opportunities they have through the business administration program and getting an insurance certificate. But what we want people in our community to understand, that Ivy Tech is a huge resource for us. Like you said, people have been furloughed, people are looking for other opportunities. But when I talk to people that are in those situations, they don't see Ivy Tech as that resource to get them back into the workforce, and get them upskilled to go back into the workforce. So what I would say to people is, if you go to Ivy Tech's website, all of these opportunities are listed there. And as we develop this program, we'll have a way for people to directly associate with the insurance industry to get more information. But we really want people to see Ivy Tech as this resource, to be able to go on the Ivy Tech platforms to find out about, how do I get into insurance? What Anne has done a wonderful job of is putting this resource on the forefront of Ivy Tech's platform, so people can have access to it.
Okay, as we got the website on the screen there for you, and I really enjoyed this conversation. I've been enlightened about the insurance industry, and so we're putting the word out there to get people on board and help rebuild this economy. Chris Lowery, Emil Ekiyor, and Anne Duncan, thank you all so much for joining us on Inside Indy.
You've messed up your son's haircut. Do you try to fix it? Work with what you've got? Or show solidarity?
Thank you, babe. You don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
Hi, I'm Kelly Vaughn, and welcome back to Inside Indy. And we have a very special guest in the interview, and not just because she is the executive director of Independent Adult Day Centers. She is also a Broad Ripple Rocket. She is Regina Smith. Welcome to Inside Indy, Regina.
Thank you. Thank you for having me. I'm so honored to be here today.
Well, we're honored to have you here, and folks are dying to know more about independent adult day centers. Who are you guys, and what do you do in the community?
Okay, good question. So who we are an adult day service. We provide services to older adults that are living with all types of cognitive challenges or diagnoses, whichever you like to say. Some of our guests are living with dementias and Alzheimer's. Some of our guests are living with post strokes, and some of them are intellectually disabled. So they run a full gamut. They're aged 18 and above. Our average guest is about 72 years of age.
Mhm.
Old, we have older, and we do have a guest in our current state about 24. So 18 and above is who we see and care
Okay.
for. Yeah.
Oh, so uh, how how when one signs up there,
hmm
how does that happen? Or somebody signing them up? Tell us, and how you benefit and you help families
hmm
with this challenge that they face in caring for someone who is an adult.
Yeah. So pretty much the services that we provide kind of, the need arises from that caregiver who is at home, a daughter or son, a husband, a wife, a friend who has been a caregiver to someone, and they still have to work, or
Mm,
they're tired, they're weary. I was a caregiver to my mom, and going
mm.
to school full time and working full time, and so even being in this industry, I just didn't know what to do with myself. And so somebody said, why don't you bring your mom to the center? So that was just a simple phone call inquiring, what do you guys provide? Because I'm in this setting, I knew what we provided, of course, but even though I knew what we provided, I didn't think my mom's needs could be met here because she was on oxygen,
Mm.
because of the dementia, the type of dementia that she had. But when I brought her in this environment, oh my goodness, some of those symptoms went away.
Are
She
you
start,
serious?
I'm so serious. She started she started remembering more because other people. She started doing what she saw other people doing, like drinking water. She would never drink anything, but if she had someone there to eat and drink with, she got that in. So those types of benefits definitely are what I needed because I couldn't be at home with her. Mom, you need a drink. Mom, you need to eat. Mom, let's go to the bathroom. But here in this environment, that's what we can do. We can get those toileting needs met. We can get that med management met. I could get those because another thing we offer is the healthcare coordination, which is phenomenal, which is very different and unique from other adult daycares, which I know you didn't ask that question, but I'll just roll right into it.
Hey, yes, hey, take it, run with it. I'm good.
Yeah,
Make
so
my job easy.
yeah, so one of our what sets us apart too with Adult Day is that we have the healthcare coordination, which is phenomenal because in healthcare coordination, that caregiver can't always take off their job and be at these doctor's appointment, or they have to take off their job and be at these doctor's appointment, or they're overwhelmed with their own healthcare issues and not always managing their loved ones' health issues as well, or mismanaging their own. With the healthcare coordination, for me, I was able to get my mom to the doctor without missing a beat. That nurse or the CNA went with my mom. They were able to give me a full report on what happened at that appointment, what the
Mm.
next steps were with that appointment. They set the transportation up for me. They took them. And so that's the same service we offer. We offer that door to door. We pick your loved one up from their home. We get them on our transportation. We bring them to the center if they're coming here. We take them to their appointments if they're going there, and not just to a doctor's appointment. We help them with their social services if they need to get down to the light company and handle that situation
Oh,
or
wow.
whatever. So that's some of the benefits of Adult Day as far as the services that we provide. When I'm looking at services or when we're looking at benefits as far as helping reduce hospitalization,
Mm,
um,
wow,
because we're
that's
able.
huge.
That's huge. So many caregivers are running back and forth to the emergency rooms,
Mm, mm, mm.
especially
Girl,
with COVID now.
oh yeah, yeah. And I've been there. My mother, and it's interesting because you talked about the challenges that some of the patients at the adult
Hmm.
center have. My mother was pretty much just like you and I.
Hmm.
She hadn't had a stroke or anything like that, but she did have sarcoidosis,
Hmm.
and
Hmm.
so the pain and the discomfort. A lot of times she was running back and forth to the emergency room,
Hmm.
and so I didn't feel like she belonged in a nursing home,
Hmm.
but she did require a doctor looking at her probably 3 or 4 times a week, as
Hmm.
opposed to once a month.
Right.
And so we were like, how do we do this where she can get the care she needs, but I don't necessarily, she doesn't need that kind of care like a nursing home, because otherwise she's
Right.
walking around the house like you and I. So I can totally to relate to this would have been perfect for her.
So in a setting, so like with your mom, well, we don't have physicians here, but we do have the RN oversight, and we
Mhm.
have LPNs and CNAs, and we have physical therapy and occupational therapy. So those therapies take place in our setting, which is phenomenal because again, that alleviates the caregiver from having to either set that therapy up in their home or transporting that therapy outside the home and making sure the loved one gets there. So those services and that emergency room run, I mean, when you cut down on running back and forth to the emergency room, that saves us financially, that keeps Medicare costs under control. And it just makes for a better relationship between a loved one because who wants to sit in the emergency room?
Right,
I mean,
right,
that's
right.
just not that was just not my thing. I hate the emergency room, and like I said, now
Mhm.
with COVID, I really hate it. So
Right.
our
Yeah.
goal is to, minimize those emergency room runs, try to keep a loved one at home as long as they possibly can in their own home, in the care of their family, where they want to be, where they should be, living out their best life, their best days in the comfort of their own home.
So how long are they there at the Independent Adult Day Center?
The
You
an
pick up
hour
at what time?
An average day, I guess, it's probably, I would say, anywhere from 5 to 8 hours a day. So, and you can pick the one thing about us, we're not contractual, so you pick and choose your day. We have on average guests are here Monday through Friday for a minimum of 8 hours. Um,
Mhm.
we are open 9 to 5 or 8 to 5 right now. Those are our COVID hours. Before COVID, we were 7 to 7. And I don't know if we'll go back to 7 to 7 or not. Our goal is to go back to 7 to 7, but right now we're 8 to 5. And so we do have a few guests in here that are here all day. Um, but
Okay.
most of them are here 3, 4 times a week, 4 to 5 hours a day.
Okay. Now we
Mhm.
just got about 3 minutes left, so I'm gonna hit a
Okay.
couple of questions because I know people are watching. Like, I want to know about
Yeah,
this. So,
great.
what about healthcare coverage?
Yep.
Is it
So
covered by insurance?
Yep. So most private insurance do not cover it. There is supplemented through Medicaid. So if we do have if a loved one has Medicaid, they can get a waiver. And waiver covers 100% of the services, the transportation, the meal program, and the adult day services, bathing services, all of that would be included.
Okay, okay. And when is a good time to consider Adult Day?
I would start considering when you start noticing that your loved one is starting to have some trouble with their ADLs and you're not able to keep up with them. And that ADLs is with their activities of daily living, when they're no longer able to keep themselves clean, or they're having
Mhm.
trouble with their gait and unbalance, and their memory issues, things like that, and you're not able to manage it as a caregiver, then that would be a great time to have that conversation.
Okay. Now, where are you guys located?
So we have 3 locations, one on the northwest side at 87th and Guyan Road, and then we have another location at Fishers at 116th and Allisonville, and then a third location at Shelby and Raymond.
Okay. And
Yeah.
What do you say to people who are concerned about the COVID-19 pandemic?
Yeah, so that's a huge thing. So we took all of the precautionary tales that went into shutting down the center. We were closed down for a while. Now that we're reopening, or have reopened, I'm sorry. We're doing all of the sanitizing that the CDC has recommended above and beyond. So every hour we are taking our guests' temperatures. We're cleaning like crazy. We COVID test weekly, all of our guests and our staff every week. And we don't just do the light one. We are up in that nasal doing a real COVID test, sending it off, getting those weekly testing. We're just reassuring them we're staying on top of the facts and not the fictions. We're listening to the CDC's recommendation daily, and we're making those changes as those changes are required for us to make. It's scary. I mean, you don't know, your mail could have COVID on it. So it's a scary thing. And so everyone has a right to be fearful, but we cannot let that fear drive us from living. So we just want to encourage people not to stop living, but know that we are trying to create as a safe environment as you are, because I have to work in this environment. I don't want COVID either. And I definitely don't want to take it home to my family.
Right, exactly. So, well, we're going to have to wrap things up, but I just wanted to mention some of the things you offer: daily exercise programs, podiatry care, outings, therapy, door-to-door transportation, counseling, lifestyle enrichment activities, and an in-house chef.
Yes, how about that? I mean, food is everything, right?
There you go.
Food is
I don't get it. I don't have a chef at home, so
right, and good food means the world. Yes. Yes.
I love it. Regina Smith, Executive Director of Independent Adult Day Centers. And again, her locations are Northwest, South, and Northeast in Hamilton County, right?
Yes, that's right.
Okay, we've got your information on the screen. Thanks so much for joining us on Inside Indy.
Thank you so much for having me. Thank you very much.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.